guys, it's Dr. Crocker, Northwest Animal Hospital. February is dental month, and we always get a million questions this time of year. People have a lot of questions about their dogs, dental health. Most recently, in the last couple of years, we've realized that maintaining good dental health in your pets really does increase their life. It increases the comfort level that they have, and pets are really good at hiding disease. And so dental disease is something that sometimes goes unnoticed and untreated. So I wanted to answer a big array of questions that we've gotten, and then also talk you through different aspects of dental health. So first off, our very excited friend, this is Mr. Cortez. He is actually from the Grapevine Animal Shelter, and he's here because he had a little bit of a skin issue, and we're going to get that treated. But I wanted to show you what you should be looking for when you check your dog's teeth. Now, he's a young guy, and so he is not going to have a lot of dental disease at this time. Thank you for the kisses. Thank you. Very sweet.
Very.
But what you're going to look at is you're going to pick up your dog's lip, and you're going to look at their teeth. And you're going to look for tartar, which is the brown staining that you'll see. The front teeth actually don't get tartar as quickly as the back teeth. So you need to make sure that you go and look at the back molars also, which can be trickier. So you're going to go all the way back and see these teeth in the very back. You'll get a lot more staining and tartar along there. The other thing you want to look for is gingivitis, which is actually swelling, redness of the gums. Sometimes the gums will even bleed a little bit if you touch them, and that's very, very painful. If you've ever had gingivitis as a person, it definitely needs to be treated by removing that tartar. So he can go back. You did it. He's at the Grapevine Animal Shelter. If anybody's looking. All right, so I have a couple of things I'm going to show you. Sorry, live video, we're moving around here. So we got a lot of great questions about when do you start doing dentals in your pets. I'm going to talk about dogs today specifically because cats, they're just a whole nother beast. Cats have different sort of dental disease. It's often harder to detect. So we're going to start with dogs today. In the dog, this is an example of what the dog mouth looks like. And you can see they have very long roots that go up into their sinuses. The canine, the root is actually almost longer than the tooth itself. So you can get root abscesses or diseases that go undetected because they're up so high. So it's very important to try to keep your dog's teeth clean and maintained so that you don't have progressive disease that then causes those teeth to need to be removed. The incisors also have very, very long roots. And when these teeth start to get loose, then you know this dog has significant dental disease, okay? So when to start dentals is a question you really need to go over with your veterinarian. Have them examine your dog. Little dogs with tiny little mouths, Chihuahuas, Pomeranians, they tend to get dental disease a lot earlier in life. We will sometimes do dentals on those dogs starting at 2-3 years old because they get significant tartar and gingivitis. A lot of their teeth are really close together, and so it tends to attract tartar and have it stick easier. Big dogs like to chew on stuff. Usually they don't eat as much soft food, and so they tend to not have dentals until later in life. So my own personal dogs, which are labs, I didn't do their first dental until they were 5 years old. And they had great teeth. They didn't ever lose any teeth in their life. And so 5 seemed to be a good age for them. So I would have your pet examined by your veterinarian, and they could give you a good idea of when to start doing dentals on them. Now, the things you can do at home are teeth brushing, and then there's definitely treats that can help to reduce the tartar and the bacteria and the smell that can occur in your pet's mouth. Now, once they have severe tartar, you're really not getting rid of that with brushing. But these are good maintenance things for when your pets are young to try to get them started on. And you know, I always get asked, when should you start brushing your dog's teeth? Well, number one, hopefully you have a good dog because it's not easy to do. And number two, if you think about it, we brush our teeth twice a day and we still get dental cleanings done on us. So twice a day would be the recommendation, and you need to make sure you get on the inside of those teeth and to the very back to really, really help to keep that tartar from building up. However, even if you're the best owner ever, you have the best pet ever, you will have to do a dental in your pet at some point in time because you're not going to be able to get under that gum line and really get to all the tartar with a toothbrush. So I would start doing it as soon as you can, give lots of treats, we have different toothpaste which are flavored. This is chicken flavored toothpaste, which sounds disgusting, but dogs seem to like it. And so you could try that, and twice a day would be the recommendation. Now, treats like CET treats. These are actually rawhide-based treats. We do have different sizes for different dogs. I think they work really well if your dog chews a lot, and especially for those really big teeth in the back, they get tartar. But if you have a dog that barely chews on it and tries to swallow it and likes to get things stuck in their throat, these are not a good thing for them. Greenies are certainly an option. There's actually a prescription food, TD, that is made by Hills, and that actually has big bites of food, and so as they chomp and they chew, it does the same thing, an enzymatic cleaning activity. So these are some options. Start them as early as you can, and this will help hopefully lengthen the time before your dog has to actually have a dental. So if they have to have a dental, or when they have to have a dental, what does that mean? Well, I would love to tell you that that means we just tell them to open their mouth and we scrape the tartar off and scale it off like you and I when we go to the dentist. However, we have many animals that don't like the sound or the feel of things in their mouth. So we do have to put them under full anesthesia for a dental. And similar to when you go to the dentist, we recommend dental X-rays. Now, a lot of people are like, my pet's eating, my pet's happy, they're not losing weight, look, they're doing okay. Dogs have a survival instinct. They will eat until their teeth are falling out of their head. I'm not kidding you. I've had dogs I've been able to pluck teeth out of their mouth, okay? Severely diseased mouths. And those dogs will still eat because they want to live, okay? So you can't always use eating as an indicator. You really need to look at the mouth and you need to assess it. So when we have them come in, we always do blood work, we do IV catheters, they're monitored while they're under anesthesia, and we do dental X-rays. I'm gonna show you an example. Similar to us, we actually do digital dental X-rays. And the nice thing about this is sometimes, like I said, those roots go up really high. And so you may have a tooth that looks perfectly fine on the surface, just a little bit of tartar. But you go to X-ray it, and on X-ray, that entire root is gone. That teeth is diseased, and that entire root has been eaten away. This tooth is infected, is painful, is loose, and needs to come out. And you can see that even on the very, very big teeth. Look at that. The surface of the tooth is present, right? But look at those roots. That root is 3/4 of the way eaten away and gone. That is severe infection, and that pet is in pain. Again, these are the incisors. This is probably a little dog because they're all kind of wonky, but these have lucencies, which means the roots are infected. So we want to make sure we don't miss this disease that's under the gum line. We want to make sure that we remove those teeth. This dog will not feel better until the teeth are out, okay? So this requires extractions, good pain medications, and sometimes antibiotics depending on the severity of disease. So that is why we do dental X-rays. There are a few cases with really young pets where we won't do dental X-rays because it's a very mild scale and polish, but majority of pets we are going to recommend these. So the machine we use, we have fancy tools just like people dentists. This is a dental machine, and Kinsey's going to show you the different apparatuses. We have a scaler, and the scaler actually pulses, and it is the same exact thing that they use on you at the dentist. And it goes up, and it gets all the tartar off, and it uses ultrasonic waves to get it off. It is an amazing machine, and it's the only thing that'll really work well. Now, after we're done cleaning them, we polish them. So the polisher applies polish just like it does on you at the dentist to maintain as long as we can that health of the tooth. Obviously, we have the water spout. Then the other thing is, if we're doing extractions, we sometimes have to section the tooth or cut it in half. And so for that, we use a drill, and we have multiple drill bits that we can use. And those will actually section teeth and help us remove diseased teeth a little bit easier. So we make sure that we do things as high quality as we can, make sure that we cause as little damage as possible. These are elevators. Some teeth are so loose, or for incisors, which are a little easier to get to and only have one root, you can just elevate them, and you actually can go up around the tooth, break down the ligament, and then pull the tooth out. So these are some of the tools that we use, and really we use them every single day. We see pets with dental disease every day. If your pet has a heart condition, has chronic kidney disease, Some of those things are definitely affected by the bacteria that's shed in the system when you have dental disease. So we want to make sure that we keep those teeth as clean as possible for those pets. Let me see if there's any other questions that I didn't answer. I have my little, oh, okay. For things that people say will help them, the different chews and different diets and things like that, I don't know that there's a specific recommendation. Dry food, I think if your pet really chews, will definitely help a little bit to decrease tartar, but some pets, especially older, need wet food, and that's okay if that's what they need. So I usually recommend combination diets for pets in general because they seem to like those for longer, so a little wet, a little dry, but I don't think one thing really helps you not to have dentals versus the other long term. Really, the biggest thing, just like in us, plays a role is genetics, breed, and age, okay? So check with your veterinarian, make sure you get those teeth looked at. You definitely want yummy smelling breath when you get all those puppy kisses from your dogs. We want them to be healthy, we want them to feel good, and we don't want to miss any disease that could be causing them discomfort. Thanks for joining us. If you guys have any other questions, you can always comment with those. Have a good day.